COVID-19 burnout at high rates. Female healthcare workers. During the pandemic, healthcare workers have been praised for working to help patients on the front lines. But the stress they've been under for nearly a year now is leading to sector-wide burnout, particularly in women. Researchers are now asking if praise alone is enough to sustain healthcare workers through the end of the pandemic. This video brought to you by HealthyRN Ways channel that talks about the COVID-19 pandemic, video posting every Monday, Wednesday and Friday. To see my other videos, see the link at the end card of this video. It's about time we start writing about this. I see this so much firsthand just at my job. The authors of a new analysis define burnout as the experience of emotional exhaustion, depersonalization, or cynicism, along with feelings of diminished personal efficacy or accomplishment in the context of the work environment. Researchers reviewed 47 global studies published between December 2019 and September 2020. All addressed one or both of the following questions: what are the triggers of stress and burnout in women in healthcare? And, what interventions are effective in preventing occupational stress and burnout? COVID-19 sheds light on organizational problems that were already there. The pandemic has helped to show that this is a systems issue that we need to address now. Otherwise, we are going to have a crisis of not having enough healthcare workers in the future. We're approaching almost a year in this. It's one thing to do something for 3 months, for 6 months, but as we're dragging on for a year, it's like, this is not sustainable. Stress in female healthcare workers. The expert focused on female healthcare workers due to the responsibilities they tend to take on in society, and because they make up 75% of all healthcare workers globally. Expert found that the primary source of stress was structural, or systems-based. For instance, many providers struggle to deal with the stress of providing emergency services in unpredictable environments. There were also concerns about ambiguous patient care protocols, and perceived lack of infection control guidelines, as well as perceived lack of support among colleagues. You show up to work, and it's a new policy today, a new policy tomorrow. Absolutely nothing is constant. These factors are then only magnified by stressors beyond the workplace. Researchers found that the majority, 66%, of female healthcare workers reported that safety concerns and fears of getting infected with COVID-19 and putting family members at risk was contributing to burnout. These women are being pushed in multiple directions, and are being praised for it, yet are avoided by others because of their proximity to infected people. Expert also highlighted that some women may be more susceptible to burnout, particularly young women with no family, or mothers with young children. New healthcare workers, too, may be more vulnerable given that they have less work experience and perceive themselves as lacking the competency to care for COVID-19. Many of her female coworkers worrying not only about work, but also their young children and providing them with a sense of normalcy in a pandemic. For those who are caregivers to aging parents, some have taken their parents out of assisted living, just to be able to see them, because a lot of these facilities have restrictions in place. Others can't see them because of these restrictions. If I get something and I take it home, that's a lot to live with. Burnout is not just a mental health issue. When you talk about burnout, the first response is that it's a mental health issue. I'm not saying it's not, but it's not only that. Yoga and therapy may help female healthcare workers cope with the pandemic, but they won't improve structural problems. Although burnout is used in many different cases, it is defined in this analysis as emotional exhaustion in the work environment. Meanwhile, the majority of studies reviewed labeled burnout as a psychological or individual issue. Only 38.3% of the studies considered workplace interventions to support the workers, and most prioritized self-focused ones, such as exercise, yoga, therapists, and hobbies. A fifth of studies did identify systems interventions, including work modifications, clear communication about policies, measures to support health professionals financially, and rest areas for sleep and recovery. Some need is just some flexibility in terms of work hours, or even a place they can go sleep if they have a short break, or access to healthy food so they don't eat junk food. When healthcare workers are offered yoga classes or training sessions, overwhelmingly, people are saying, that's not enough. Thanks for offering this, but I just need time for myself. The workflow of the day be modified. Ideally, we should have a certain number of patients per day, a certain time limit, which would allow physicians time to recover from the emotional burden. If not, we can already hear all these rumblings of a mass exodus from healthcare. We really should start looking to our leaders and organizations to put forward solutions. The onus can't just be on the individual. The irony of the frontline hero, if self-focused interventions don't cut it, then praising female healthcare workers as heroes isn't enough. The authors write that ironically, it might increase stress and burnout. The societal and media portrayal of healthcare workers as heroes increased moral responsibility and caused increased stress to meet these expectations, yet health professionals faced increased social isolation and stigma as they were considered as contagious by the general population. Imagining what female healthcare workers are going through in the pandemic can make them seem like miracle workers. But remember that at the same time, they're juggling so many different glass balls. The hardest part is continuously reassuring our parents because the doctor's office is one of the last socially acceptable places to still go. We are underestimating the loneliness, the anxiety, the depression that our patients are currently struggling with right now, and the doctor is the only outlet they have to turn to right now. Doctors can heal from a year of burnout. Since 1933, March 30th has been recognized as National Doctors' Day. May is International Nurses' Day, a day to acknowledge the incredible work of physicians and the other healthcare provider contributions they make to their communities. This year, the team celebrates the endurance of medical professionals who've been faced with unprecedented demands. We know burnout exists among physicians and frontline workers, but the reality is that they're often faced with the expectation that they can deal with the trauma of COVID-19 on their own. We reached out to some of the physicians and nurses on our medical review board to learn about their year, their triumphs, their challenges, their wellness tips. Here's what they shared. 1. Coaching and mindfulness practices were key. For those who has over 10 years of experience in the California public health system, the meditation practice she started prior to the pandemic became more useful than ever. She aims for 30 minutes a day, but says even 5 or 10 minutes helps. Sometimes it's all the time you can take for yourself. Working with a career coach who is also a physician to address the challenges of working long hours in stressful situations. Coaching has been transformational. It has allowed to reframe both specific work situations and bigger picture career issues with the perspective of a supportive outside observer. Staying positive and celebrating scientific breakthroughs, and attending emergency medicine physician in New York, worried from the start that he'd contract the disease or bring it home to his family. The scariest thing being on the front line was the unknown. But watching the vaccine development, testing, and resulting efficacy was a huge moment in medicine, and seeing the subsequent downtrending cases of COVID-19 has been even more promising. It was tough to stay positive during this troubling year. At one point it was hard to see the light at the end of the tunnel. But the medical field along with the general public rallied and developed a deep camaraderie that helped advance us to where we are today. 2. How to deal with burnout. Physicians are dealing with grief, trauma, and PTSD, but often aren't given the tools to heal or acknowledge that they're struggling. Ways to help this process, which are equally useful for non-physicians. Practice self-compassion. Research shows toxic self-blame is at the root of burnout for many physicians, especially women. Beware of the tendency to think everything is your fault. When you catch yourself being overly critical or blaming yourself too much, ask what you'd say to a friend. Give yourself those same kind, compassionate words. Seek online therapy. Some physicians are afraid to seek help in their communities due to fears that a mental health diagnosis could impact their careers. Most online therapy programs allow patients to use nicknames so you can remain anonymous while seeking treatment. Most online therapists don't offer an official diagnosis, which might appeal to anyone who doesn't want to be labeled with a disorder. Use online screening tools. This can help you get some objective data about whether you may be experiencing depression, anxiety, or another mental health issue. Take time off. Studies show about a third of physicians only take 2 weeks off per year at most. Time away from work is vital to good mental health. Use your vacation time to distress and take care of yourself. As a physician, take time to make your mental wellness a priority. Take these small steps to prioritize yourself on National Doctors Day. Schedule brief relaxation and stress management breaks. Plan regular therapist consultations. Make time-outs for mental refreshments with deep breathing or meditation. Maintain helpful positive self-talk. Create habits to avoid overgeneralizing fears. Accept that situations cannot change. Nurture environments that enhance moods of patience, tolerance, and hope. And if you're not a doctor, try these tips out. We have all been impacted by this year of the pandemic. As physicians and frontline workers, we must acknowledge that taking care of our mental wellness directly affects our ability to be present and also fully serve our patients. Physician burnout can easily create toxic environments in all spectrums of our lives. We hope this moment of mental pause can help reassure you of the quality time and attention that you deserve today on National Doctors Day and every day. Researchers reviewed studies that looked at triggers of stress for female healthcare workers and interventions in preventing burnout during the COVID-19 pandemic. Most women reported stress related to issues like unclear and inconsistent protocols and lack of support at work. Self-focused solutions, such as yoga and therapy, receive more research attention than system-oriented solutions, but may be less effective. I wish I had a prescription for hope and just can magically make things go away. Please like, share and subscribe to my channel. Thank you for watching. See you on my next video. Ma salama.